right, welcome to Moments with Dr. Heather Henley, where we bridge the gap between mental health and ministry. I am your host, Dr. Heather Henley, known as the master of crisis therapy. Listen, we have a great show for you today. So let's talk about it. We're talking about a trauma-informed approach. And so what is important is that we understand what trauma looks like. So I'm going to go through just a few basic points just to help you. Number one, we want to realize just the widespread impact of trauma and understand the potential paths of recovery. Two, we want to recognize the signs and symptoms of traumas in our individuals that are at our church. It is important that we understand the experiences that families are going through, even because of the pandemic. Three, we want to respond by fully integrating knowledge just about trauma into our church practices. And I just want to ensure that churches are looking into counsel for their members. And then lastly, I want to at least give you 6 activation tools. I want to give you 6 tools where you can try to resist so that there is no re-traumatization. So come on and take this journey with me. So first, I just want to talk. What is trauma? A lot of times, we are in the church and we are not understanding that individuals have experienced some level of trauma. So I want to put language to it. So trauma is an emotional response to any intense event that threatens or causes harm. It can be a physical or an emotional, a real or a perceived trauma. And it can be administered by someone that is close to us. Trauma can be the single result of one event, or it can be exposure to multiple events over time. Now, in the church, we are looked at as a body that is similar to a hospital. So if you have individuals coming in and they're in an emergency, you have to be able to address the trauma. So let's talk about how the impact of trauma affects others when it's untreated. So the first thing would be that it affects our bodies. How would it affect our bodies? The way that it affects our bodies is an inability to control physical responses such as stress. Life takes us on a journey, and us being able to come to the house of the Lord so that we can find refuge, it is important and key for us to slowly begin to unpack some of those stresses that we are experiencing as individuals, as families, as a society, and definitely as a church. In addition, it can cause chronic illness, even into our adulthood. If it starts when we are children, it can cause obesity, it can cause heart disease. And so a lot of times as ministers, we talk about that premature death. Well, when we are not dealing with our unresolved needs, our unmet issues, and dealing with those complexities of trauma that we may have experienced along from childhood, even into our adulthood, these are some of the issues that are created because of these types of traumas. The second thing would be trauma affects our brain. It causes us at times to have difficulty in thinking. It causes us to lose concentration. I would ask, have you ever been in a place where you knew that you knew something, but you couldn't remember? Sometimes the trauma that we experience, it affects just the places in our mind. And so it causes memory to be impaired. I remember a time when I was experiencing some triggers from a past trauma, It caused me to be under severe stress where I became anxious. I struggled with remembering things, and it caused difficulty even when I was in school because I was having a hard time sleeping. And so because of the fact that I was experiencing severe trauma, I was unable to perform at the level that I needed to perform at on a collegiate level. I remember it clearly. During that time, it was a very rough semester for me. I struggled with wanting to take care of my children. I was at a very low point. I wanted to leave and not be there with my children. I contemplated even leaving. I contemplating running away, leaving my children at home on so many occasions because of the stress, because of the intensity. I was feeling dejected. I had a loss of disparity just about things that were going on with me. And so it caused me during that time, I didn't have a good semester. I believe my grades dropped from probably a 3.5 to maybe a 1.9, almost a 2.0 cumulative grade point average. What am I saying? I'm saying that when trauma is undetected or there's unresolved trauma, it causes us to have learning and concentration issues. We have an impaired memory. Also, it calls for difficulty from switching from one thought to the next. I would say that my thoughts were racing. So it made it difficult for me to complete conversations. I would talk about one thing, but quickly switch to something else, causing for individuals to be confused or my language, my communication wasn't clear. So these are some things that that happens with the brain when there's just unresolved trauma. Another thing would be emotions. Let's talk about our emotions. When we have unresolved issues, unmet needs, when we have complexities of trauma that we haven't dealt with, it causes us to become emotionally unstable. We flow in dysfunction. So the things that are going on around us, we look at them as being normal behavior. Let's take, for example, low self-esteem. Because there was so much complexities of trauma with me, I struggled with my esteem. I struggled with just how individuals saw me. It made it difficult even when I was trying to move into different spaces of leadership, when I was trying to move into different spaces of employment, or even when I was trying to move in spaces of ministry. Because I was struggling with this low self-esteem, I sought out validation even from members of my church. And so because I was seeking this validation, I presented as though I lacked self-control or I lacked the ability to complete assignments because I was always looking for a level of validation. So what am I saying? That when your emotions are unstable, there is no way that you can assist others or bring them to a level of continuity even in their lives. Second, I was feeling unsafe. I felt that everybody was out to get me. Have you ever been in a place where you felt as though somebody was out to get you? Or every time there was a situation or an issue, you never could take accountability for your actions, but you always found the fault of the other person. Listen, we're talking about feeling unsafe. We're talking about just some approaches to trauma and what even causes the trauma. Then there's an inability to self-regulate emotions. So that means that when you're interacting with your friends or family, you find yourself having emotional breakdowns. I can remember there was a time where I felt as though I needed to have some type of confirmation or affirmation from my friends. And this level of emotional stability that I was looking for them helped me to just kind of regulate. But how many know the only person that can regulate your emotions is Jesus? So then we had difficulty forming attachments because my emotions were unregulated. It caused me difficulty in finding true attachments, finding individuals that really had my best interests at heart. I began to seek out relationships that were similar to mine. I sought out people that were emotionally damaged. I sought out individuals that couldn't regulate their emotions, that sought out attention. And so I was the person that was giving them the attention that they were seeking. We're talking about complex trauma, and we're talking about what is it that we need to do when we are trying to assist individuals in ministries. It is important for us to understand those complexities. Another thing under emotions, trouble with friendship. How many times have you had trouble finding friends? Or you found a friend this week, but they did something to you to cause you to want to change your friendship and you just met them, or you found it difficult to establish friendships. You know, the greatest friend that we have is Jesus. And so the one thing that we can say about friendships is in order to have a friendship, you have to present yourself friendly. But when you are emotionally unstable, when there's a level of dysfunction in your emotions, it is difficult at that time for you to find friendships. Lastly, trust issues. It is difficult for you to make true relationships when you feel that you have to put on a performance in order to, number one, obtain the friendship, but then you put up barriers and walls in order to test the individual concerning their trust. So with these things in mind, it is important that if within ministry that we look at finding ways to handle or deal with individuals' trauma. I am excited that even on this journey, that we will begin to talk about some of those complexities and then come up with some type of approach so that we can bring these type of informed approaches concerning trauma into our churches. My name is Dr. Henley. I am so glad that you all had an opportunity to join me today. This is the month that we're going to talk about complex traumas. So be sure to tune in next week where I will be talking about the next step of complex traumas. Hey, I'm Dr. Heather Nicole Henley, and I want to show you two resources. I am in Orange Uncompromisingly, where we focus on choices, courage, and change. And my second resource is Influence the Mindset, where we remove the barriers, restore your vision, and reclaim your mind.